In this episode of Spearlift, we speak about the delicate issue of suicide and about suicidal tendencies that people may be having. So stay tuned. In this episode of Spearlift, I speak with Dr. Pilar Carriedo, psychiatrist from Mexico City, who will give us valuable insight into how someone can deal with individual suicidal thoughts and help others who may be facing this very difficult situation. Before we get started, please make sure to subscribe, like, and share this video if you believe it can really help others and support our channel. Dr. Pilar, it's a pleasure to have you back on Spearlift.
Thank you so much, Devin, for inviting me again.
I greatly appreciate it. And this is a very difficult topic to address, but I believe you're the right person we can speak to regarding this. And 2020 has been a year in which has challenged many people in many ways, not just lockdowns in countries because of the coronavirus, but economically. People are suffering with work-related issues, economics, finance-related issues, and this has not been an easy year, to say the least. There's been also relationship issues with people in the home. Not me. Me and my wife are having a great time. But this has just been a year that's really challenged us emotionally, physically, mentally, in so many ways. And now more than ever, it seems like more and more people are unfortunately having had committed suicide, have been thinking about suicide or contemplating it. And it's not an easy thing. So I wanted to do this episode with you so you can maybe give some very valuable insight to anyone who may be suffering with this situation now, and also how they could help people who they may know be dealing with this. So thank you so much again. And to start, what is, in your opinion, well, not I don't want to say opinion, from your work experience, handling people, patients who are going through this now and who have gone through these thoughts in their mind, what do you say to them to help them?
Well, it's important to know that sometimes our emotional problems or our economic problems, family problems can look so difficult to overcome that suicide may be the only option that we imagine. Sometimes we don't see any other possible result, any possible solution. So people sometimes think that suicide is actually the best option, but we have to remember that suicide is a permanent solution for a temporary problem. Any problem that we might be facing is temporary. As hard as it may seem, it has a solution. You know, any problem in our lives has a solution except death. So I think that's a very important thing to keep in mind. And well, when we find someone who has this suicidal thoughts, who wants to harm himself or herself, well, the first thing we have to do is listen. We have to listen in an empathic way, without judging. That's very important. You don't know what that person is going through. It might seem to you that his or her problems are not as important or as dramatic maybe, but you don't know how that person is experiencing them. For them, it might be something that has no solution, that has no escape. So we have to listen without judging and trying to understand the other person's point of view, and trying to lend a hand, trying to let that person know that we are there for them, that we are willing to help, and also try to help that person to seek professional help, with a psychiatrist, with a psychologist, depending on the severity of the suicidal thoughts. But that's very important, especially listening. So if anyone who's listening to this has encountered someone who has these suicidal thoughts, don't judge, listen, and seek help with that person. Seek professional help. I think that's the most important thing.
No, that's very important, and that's excellent insight, as far as what we should do and really help others in that way. And thank you for that, Doctor. And I worry, and I think other people do too, about maybe certain people who kind of mask their situation, their struggle. I think there's a lot of people out there who, on the outside, everything looks fine, and they, are just I'm sorry, I get a little bit torn up talking about this because it's quite
hard.
difficult. Yeah.
Mm-hmm.
But, I think there's a lot of people out there that, will not admit that they are going through something, and then unfortunately they're the ones that take their life. Man, that is, I don't know how to frame this question properly, but I'll do my best. I think for those out there who do have demons, but they don't want to share with others how they feel and what they're going through, what's your message to them?
I would tell them that each and every one of us has demons. All of us are fighting our own fights. Life is not easy for any of us. And maybe sometimes we don't want to talk to others because we need to appear strong. Perhaps if you're a dad or a mom, or if you have a very important job, perhaps if you have to take care of a lot of people, or even in this society, even now, men, for example, are not allowed to show their feelings or to talk about their emotions. But really, all of us are fighting our own battles, in our heads. All of us have problems, and sometimes if we open up, we will find the support that we need, or we will find solutions, in the experience of other people, and that support can be more helpful than people actually think. Because maybe other people are experiencing similar battles to yours, or maybe they know the right words or the right way to help you. So, as I said before, it's suicide. It's a permanent solution for a temporary problem. So the thing that we should do is to find a solution for that temporary problem, and maybe other people, maybe they can help us find a solution. Because when we are depressed, or when we have this kind of thoughts, self-injury or suicide, maybe our judgment isn't as clear as it should be. Maybe we can't see further, because everything is cloudy, everything is dark, and we can't see beyond those clouds, beyond that darkness. And maybe someone else can help us see beyond that and find a solution to our problems. So that's what I would tell them, that sometimes problems aren't as hard to bear if we share them with other people.
Yeah, and I think based on what you're saying in that regard, I think it's definitely an issue, especially for people like that who, I don't know, I wouldn't say that they're maybe complete introverts, but they like to keep at least the demons inside, and they might be the light of the party, and very outgoing and things like that, but they suppress that other part of them, or at least they don't expose it to the general public. When I say general public, people around them or people that know them, who are close to them. And it just, how does, for that particular situation, or I guess for anyone in general, having these thoughts and feelings, for lack of a better word, demons, that just really haunt you. What is that like from the science part of it? Like from your profession, what does that actually do inside the brain? Is there a way to explain that? Just have an idea, like how does that affect the way in which we, if people are dealing with this, like have that stuck inside of us? Is there a way to explain
that? So what it happens is that all of these worries and problems, daily stress and vital life events, negative events, they create stress, hormone levels and inflammatory molecules tend to rise when there is stress, not only physical stress, but also emotional stress. And this, if it perpetuates, it can cause a mental disease, for example, depression or an anxiety disorder. And either of those or any other mental disorder can result in suicidal thoughts. Also, I think this is important. You don't have to have a mental disorder, to meet the criteria for a disorder to have suicidal thoughts. Sometimes problems are so intense, perhaps you lost your job, you lost your house, you lost your wife, she took the kids and you can't see them again, and like everything comes together, and you don't have to meet the criteria for a mental disorder to have a suicidal thought. Sometimes people who commit suicide don't really have a psychiatric diagnosis. It can be just that their problems in that specific moment, were so intense and so difficult to bear that they decided that suicide was the best option. And I would like to add this. I have heard some people say that this is them being cowards. What I like to tell them is that it's not them being cowards. It's really that they think that people around them, the people they love, are going to be better without them. That they will, perhaps they will suffer in the beginning, but in the end they will be better without them. So it's not about bravery or the lack of bravery. It's really that their thoughts, their judgment tends to go that way. Everyone would be better without me. Life would be better if I hadn't been born, or if I didn't exist. And people, they will mourn me for a while, but in the long run, they will be better.
That's a very important insight, and I think it almost sounds like when we're having this conversation that it's to release these thoughts, and I could be completely wrong, but I'm just forming my own analysis here, is like we almost have to be able to have a deeper conversation, realization for ourselves if we are going through this, to really speak to ourselves and be honest with ourselves, to be able to transition out of this in a way. It seems like having a conversation with ourselves and tapping into that part inside of us that needs to be spoken to be able to recognize it, is part of the transition of getting out of those tendencies, away from those demons. Is that something, just going through this conversation together, it seems like that is an important aspect in a way. Would you agree?
You're totally right. Sharing, knowing that it is okay to talk about this kind of things makes it all a little bit better, a little easier to bear. Sometimes when people come with suicidal thoughts, perhaps they haven't told anyone, not even their husband or spouse or friends or parents. Perhaps they haven't told anyone, and when they speak of it, stress starts going down. They start feeling better because they're feeling listened, understood, and they start feeling better. So sometimes that helps. That starts showing the person that they have support, from someone, and then they tell other people to seek for more support.
Have you seen, Doctor, this year in particular, in 2020, like more so with people and possibly patients, the lockdowns, everything that COVID has done, really impacted people and led to this way? Have you personally witnessed that?
I have seen that this year has been really challenging for everyone, and all of my, not all of them, but many of my patients have become more anxious or more depressed, perhaps because they lost their jobs or because there's a problem, with school, or they can't see their friends anymore. They're having troubles with their family and they have to be locked with them. It's been really challenging for everyone. So I have seen an increase in depression, in anxiety, in insomnia, in many symptoms. And sometimes these symptoms come with suicidal ideation, or even just with the fantasy of not waking up, perhaps, or disappearing. No, not precisely suicidal thoughts, but yes, the idea of what if I go to bed and never wake up, or what if I disappear and no one ever hears from me again, or what if I just run away and never come back. That kind of thoughts are really, really frequent right now.
But is that in a way, for these people who experience that, is that in a way that's glamorized, or are those actual demons? And the reason I phrase my question like that is because, unfortunately, there's some, let's say, I don't want to call them entertainment shows, but there are shows that have come out, in recent years, that put glamorization on this issue, and that's so sad. I just can't believe that's even accepted, and I don't know how those shows are allowed to exist, but they do. And so there's this kind of like going within that same notion that you had just mentioned and description with some people. It's like there's some people are like, oh, if I am gone and I never come back, then it's an adventure or something. I think that's so awful. Do you see people like that seen it in that way?
I think most of the people, in most of them, there are actually demons. It's something that they actually think, that they actually want in a way, because they start seeing everything as very difficult or very unlikely to resolve in a favorable way. In some other ways, I think what you mentioned, it is very important. For example, there some studies show that after some TV shows or movies are on the air, such as this TV show 13 Reasons Why, for example, suicides tend to increase. In that specific case, in that TV show, the teenage suicides were the ones who increased in the, I think it was 1 or 2 months after the airing of the second season of that show. And that's important, because those kind of things, also when there's a celebrity suicide, that's actually very important, because there's a very interesting and sad phenomenon that some people tend to imitate that behavior. So suicide rates tend to go up in specific groups of the population after that kind of things happen.
That really bothers me in a way, because it bothers me in the sense that if the people that make this material may have an understanding of what it might, conjure into the public in that way, and what the ramifications for be, you would think they would think twice about this stuff. But it infuriates me personally that it can even exist, and be allowed. It's just, I can't. That bothers me a lot, and I just wish that we were in a society, or societies, that would really just, I don't know, teach kids, younger people. And this probably could happen with at any age bracket, but what I'm trying to get at is, this worries me a lot, especially the younger people. Okay, where I don't, and maybe you can speak to this as well. How much do you see social media and the use of it, especially with younger people, leading to suicidal tendencies? More than other age brackets, I guess.
I think this is very important. There have been different social media posts that, for example, a few months ago, there was it wasn't like a rumor. Some schools in the US started to notify that there was live suicide being streamed on social media, and they were asking parents to keep an eye on what their kids were seeing on social media, so they wouldn't end up seeing it live, or the recording of it. So that kind of stuff really impacts, especially young people, teenagers and young adults. And the difficult thing about this is that phenomenon which I was talking about, in which they tend to copy or to imitate this kind of behavior. Also, I think it's very important that social media has allowed bullying, for example. It has allowed bullying to go to a different level. It doesn't just stay inside a school or inside a classroom. It can go to unspeakable levels and reach so much more many more kids than it used to, and that has a more severe impact on kids these days, because they are not just bullied in the classroom. They also get videos posted or posts about themselves, criticizing them. And I think that must be horrible. So I think that also promotes this kind of behavior.
That's a very important point. And I think even probably the bullying comes more online, actually, than it does in person. And when I see something like TikTok, there's so many social media platforms, but TikTok, especially with the younger generation, seems to really taking over that generation like a tidal wave. And it really seems like everything that someone does or says, it has to be on that, like, all day, every day. And
Yeah.
it blows my mind. I mean, look, I'm on social media platforms, and honestly, personally, I would prefer having a lot less exposure, like, with what I do, because I am quite private, to be honest. But I think I feel in my heart what I'm doing with Spiritlift is important, so I'm willing to be on platforms and share this information, and doing what we're doing now. I mean, I'm willing to do that, but I just can't imagine. I mean, I'm still kind of young. I don't know, but I mean, I grew up in my teenage years before the internet, so I was outside all the time, and I was, you were never sharing yourself like on the internet. Like, that wasn't a thing. But now this is a whole different thing that I see the next generation having to cope with. And I think, going in line with what you're saying, is that if I don't like, I've seen instances where younger kids will, post something on this platform, and then somebody will come up and just obliterate them on the next TikTok posting, and the kid is just severely damaged. It's unbelievable to me.
Yeah, it is. Yeah, sometimes we don't know the impact that one of our posts may have on someone else, but perhaps someone uploaded a part of their life, because they are, getting themselves out there for everyone to judge, because that is what people do on social media. They judge everyone without knowing the whole story, and sometimes they write such hateful comments. They don't know what impact those comments may have on the person who posted information, or perhaps just a photograph. You never know.
It's unbelievable. And this might sound a little silly, but one of my actual favorite shows in recent times has been Cobra Kai, which is on Netflix. And it's interesting. I don't know if you've seen it, but it's basically some of the cast from the original Karate Kid movie from the 80s. And it's focused around the guy, I think his name is Johnny, a blonde hair guy, who was fighting, I'm bad with names sometimes, fighting the protagonist in that movie. And it's centered around him. But what's interesting about that show is, like, they show this guy who's older in the show, dealing with training the younger generation now about issues in life. I mean, karate for sure, but other issues, like, they're always trying to be correct and this and that, and then this Johnny guy's like, shut up, like, he's rough. But I mean, they're coming from two different worlds essentially, but he's giving, what's interesting about the show is, like, he's trying to toughen. Sometimes his tactics are not good, to be honest, but what he does is instill a confidence in this younger generation and saying, get off the phone, you got to train, you got to build that toughness inside of you to survive in this world. You got to be strong, you got to be confident, you're your own, man, woman, you can stand your own ground. And so I think it's interesting that show is showing that discrepancy of the generational way of seeing life, but they teach each other different things as well, which is good. But I think that's what really is missing in a way, is just, like, everything's got to make me feel recognized and not, noticed and da-da-da. And the moment that is tarnished or affected, does severe damage to that person, unfortunately, so
Mhm.
Doctor, I just want to conclude with this. What would you recommend? This is a two-part question for you. What would you recommend right now to a person who may seriously be in a really bad situation, contemplating this? They're in a very, like deep state of having these kind of thoughts. What would be your message to them right now for them to turn their life around? And what can they do, like the actual doings, whatever it is, what can they actually do step by step, day by day, to get better? And my second question is, what would be your message for those who know somebody in this situation, how they can best help them right now?
Okay. For those who are experiencing this kind of thoughts, I would tell them to seek help, to talk about it. It's okay to talk about the dark thoughts that go inside your head. It's okay to talk about how sad you are, how anxious, how life might be going really bad for you right now. It's okay to talk about it, and there might be more people out there willing to listen to you than you think. And there might be more people dealing with similar issues as you are, than you think. So I would tell them to reach to others, to talk about this. Sometimes finding a solution is difficult, but other people can help us with this. And I know it's really hard when you're having really really tough problems in your life, but it's also, I don't know if this is good advice, but it is good to just look around yourself and look at all the good things that you have. Sometimes they can outweigh the negative aspects, but sometimes as many good things as we can have in our lives, sometimes we don't think that they're enough, or we think that we are damaging everyone, we are spoiling everything for everyone. So we conclude that the best thing is just to get out of the picture, and that's not reality. So every problem that you may have is a bit easier to bear if you share it with someone else. And there, quite possibly there might be a solution for your problem, no matter how horrible it is. Time, as they say, time fixes everything. You just have to give yourself a chance. And life is full of difficult experiences, but we have to let them nourish us and make us grow. And as I said before, we can't choose a permanent solution that might affect everyone else in our lives and might deprive us from experiencing really, really good things, in the future, because we can't find a solution right now. So that's what I would tell them, to seek help, and to talk about this. It's okay to talk about mental health. And sorry.
No, you go ahead. I'm sorry.
And to those people who know someone, there are two possibilities here. You might know someone who has told you explicitly that they want to harm themselves or they want to kill themselves. The first step, as we said before, is to listen and then to seek help. You might find help in a psychiatrist. You might take that person to a psychiatric hospital, to an emergency department to seek help. They can be evaluated if they need perhaps some medication to feel better, to sleep better, to be less sad, less anxious. that may help. They might need therapy, so you should help them find professional help. And there's another possibility. Sometimes people don't tell others that they want to harm themselves, even though I think it's important for people to know that most of the people who commit suicide tell someone that they want to hurt themselves. So whenever someone tells us that they want to commit suicide or harm themselves in any way, we must always pay attention. Don't take them for granted. Don't think that they're just trying to manipulate or to seek attention. Sometimes people tend to think that these people are manipulating, and they don't pay enough attention until it is too late. So whenever someone tells us that they want to harm themselves, we always have to pay attention. If this person doesn't tell us anything, but we see some red flags, for example, the person is sad, is isolated, doesn't talk to anyone anymore, he's not eating, he's not sleeping, or he's sleeping too much, he hasn't shown up for school or for work, he's not interested in the same activities that he was before, he's always crying, or he's always angry, aggressive, those kind of things, they have to be warnings for us. And we have to be patient, approach that person with empathy, and be willing to listen and to be there for them. Sometimes they don't want to talk, but we have to be there for them. Sometimes they want us to go away, but we have to let them know that we're not going away. We're going to be there because we're there for them. We care about them and we love them. So we're going to be there, and we're not going to leave them alone because we care about them. And no, our lives would not be better without them, as they might be thinking. So I think that would be important. And yes, I mean, we should try to convince them to seek help, but without forcing them, because it's better when they decide by themselves that they do need help and they want to be helped.
Such valuable, important, and insightful comments, Doctor. And I thank you so much for this talk today. I thank you so much for being on Spirit Lift again. And I encourage anyone out there who's dealing with their own personal demons to please take the doctor's advice and seek the appropriate help. And if you know anyone who is dealing with this as well, please help them. And if you want to mind, Doctor, what is okay if I include your information in the description?
Yeah, sure. No problem.
Yeah. Okay. Thank you so much, Doctor. And thank you for everyone viewing this episode. And we'll see you on the next episode of Spirit Lift.